everybody. I am Maria Ruggiero. I am the Prevention Program Manager here at the Frontline Initiative, which is located out of the Tewksbury Police Department, as well as a working group member of the Prevention Professionals of Northern Middlesex, or PPNM, like we love our acronyms. Thanks for having us back into your home again. This is part 2 of the Frontline Initiative and what our services are. So today we have a familiar face, Kate Bergeron. Hi, thanks for coming back, Kate. We have CK Knowles and Rachel Beers. So ladies, if you could just take a moment and tell us a little bit about yourself and what you do for the Frontline Initiative. We'll start with Kate.
Hi, everyone. My name is Kate Bergeron. I am a grant project coordinator for the Frontline Initiative and also for covering towns within the Prevention Professionals of Northern Middlesex. I support the team in helping to provide substance use disorder services with a special focus on preventing opioid overdoses.
And if you didn't see part 1, where Kate and I talked about that response a little bit in detail in Narcan, please find on your local stations where you can see it. Thanks again, Kate. Our next guest today is CK Knowles. CK, tell us a little bit about yourself and what you do.
My name is CK Knowles, and I'm a master's level social worker. And my role with Frontline is a co-response clinician.
Excellent, thank you. And then Rachel Beers, give us a little bit about yourself, please.
Hi, everyone. I'm Rachel Beers, and I have the same role as CK Knowles, and I'm also a master level clinician, and we work together co-responding to various towns.
Okay, so Kate, could you tell us, please, what communities are within the Frontline? So for the PPNM, we have the communities of Billerica, Chelmsford, Dracut, Lowell, Tewksbury, Tingsboro, Westford, and Wilmington, and that's all located or based specifically out of the Tewksbury Police Department. Is the Frontline communities different, Kate?
Yes, Maria, they are. The Frontline Initiative, in addition to being part of the Prevention Professionals of Northern Middlesex, is a collaborative police mental health substance use disorder collaborative, and it covers the towns of Tewksbury, Billerica, Chelmsford, Dracut, and Tingsboro.
Now, I have to wonder if somebody from Lowell, for example, is in Tewksbury and has an issue for whatever reason, they've been introduced to the police department, will we still work with that person if they don't live in one of those communities? Kate?
Oh, absolutely. Especially if they are currently in one of those communities. We respond to anyone from anywhere in the country, really, as long as they are currently in one of our communities. And then for anyone who might have had a police interaction and also has a co-occurring mental health or substance use concern that doesn't live in our community, we are doing some therapy, some meetings via Zoom right now, and then also we do a lot of referrals back to local organizations for people who might live outside of our catchment, but we still are happy to provide a service, or a referral.
Okay, excellent. So CK, what does the Frontline Initiative do, and are you responsible for specific communities?
So the Frontline is the behavioral health entity of the local police departments. We're responsible for the oversight of the prevention, crisis response, and recovery programs. And I cover the Tewksbury and Billerica communities.
Excellent. How about you, Rachel? What communities do you cover, and what is your kind of input on what the Frontline does?
Sure. I cover the communities of Dracut, Chelmsford, and Tingsboro. And just to kind of piggyback off of what CK said, our roles as co-response clinicians are to co-respond with the police to behavioral health emergencies. And we provide outpatient therapy, case management, we coordinate care between providers. And even though I cover certain towns and CK covers certain towns, if one of us is not available, the other one should be. And just so everyone knows, we offer 24/7 coverage as well.
Wow. So if a circumstance happens at 1 o'clock in the morning, there's somebody that can work with that individual and help them?
That's correct. Between CK and I, there's an on-call number that officers can call after hours or on weekends. So one of us will pick up.
Okay, wonderful. CK, could you tell us a little bit about how does somebody get, how does somebody work, somebody in the community, how do we reach out And
Yeah,
how do they get
so
involved?
the most important thing to know is that you do not need to be police involved to get help from Frontline. And actually, we'd prefer that, you weren't involved with the police. You can walk right into the police department in Tewksbury. We have a behavioral health window that's accessible in the lobby, and somebody is there between the hours of 8 a.m. and 4 p.m.
Excellent. Rachel, what is your, I guess I'll say opinion or kind of feedback on how somebody can get involved with the Frontline?
Yeah, I think if you can't bring yourself into the station, there's a number of different ways you can get involved with us, to include Facebook, Twitter, Instagram. You could go on the town website. You could call into dispatch and ask for a clinician. We also have a website, the Frontline Credible Mind website, or our community, the phone number, in which we'll post at the end of this video, but each of CK and I both have numbers that are available to the community that they can call, leave us a voicemail, and we'll get back to them.
Excellent, and we'll have that information at the end. Kate, could you give us an idea of why everything is based out of police departments? Now, my understanding is it's Billerica, Chelmsford, Dracut, Tewksbury, and Tingsboro police departments. Why is it in the police department?
So that's a great question, Maria. I can actually speak to that from both sides in my current role right now, but also for a number of years on the provider side. I think the police department over time found that there were people kind of falling through the cracks in the mental health and substance use disorder treatment system. And over time, the department realized that a number of calls, really ever increasing, were related to behavioral health emergencies. So in response to the needs of the community, they have developed this program out of the police departments to ensure that everyone is served. So we don't bill insurance, services are completely free and they're accessible to anyone. And that has made access to service a lot easier for folks.
You know, I remember years ago when somebody would continue to come be arrested or continue to be, to the police department. It wasn't that they were committing major crimes. It was that they were struggling with either substance abuse disorder or they were struggling with behavioral health. So these programs were created to kind of have that balance between, obviously if there's something that somebody's committing a crime, the police are there. That's what their jobs are to do, is to keep us safe in our communities for people who are committing crimes. But for the people who might be committing a crime based on the disease of addiction or mental health, it was just really nice to see it kind of meld in with the police department. So it's more of a community response. So CK, how does somebody get involved? Could you give us a couple examples of, not necessarily people that you're working with, but a couple examples of how you've been introduced to somebody that's one of your clients?
So I work alongside the local schools in both Billerica and Tewksbury school districts, and sometimes I will get calls from a guidance counselor or a school resource officer asking for me to meet with a student and their family to see if there are any needs that we could help them meet. We can offer them resources and support to get their child back on track with school. Also, we work with the homeless individuals in both communities also. I've been referred individuals either through the police department, or if I'm driving by and I see somebody, in the middle of a intersection, asking for money, I will, pull over and get out and go talk to them and see if there's anything we can do to help them as well.
So to me, it sounds as though we're trying, like somebody had said, we're trying to prevent, we're trying to get to people before that it escalates into something that's more serious. And now they are involved with the police, but they're involved with the police due to handcuffs. Rachel, is it the same, set up the same way in your communities? Give me a couple of examples or an example of somebody that you'd be working with in one of your communities.
Yeah, it's relatively the same to what CK said, but if somebody were to call dispatch, for example, and ask for a clinician, it's not necessarily the same thing as just calling 911 and having police show up. They've kind of cut out the middleman and asked specifically for a clinician. And so the dispatch will put them through to me and I'll speak with them on the phone and figure out what's going on, whether or not I need to go out there. Sometimes people call in for themselves or loved ones. It doesn't necessarily have to be for you. You could be doing it for somebody else. And like I said before, there's some social media outlets too that you can go on and get more information and figure out if we can help you or a loved one in any way, or just showing up in person to the station as well.
So, in part one of this, Kate, you and I talked about Narcan and the transportation piece. How does that work within what CK and Rachel do?
Absolutely. So we work as a team, all of us together. There are addiction specialists on the team as well. And they reach out to folks who might have encountered the police during some type of substance use crisis or may have been struggling with substance use disorder at the time of their encounter. So at the time that we do those outreach calls, we also offer assistance with case management, with transportation. We kind of discuss what people might be interested in on their recovery journey if they're willing to start or consider starting a recovery journey at that time. And one of the things that we can do is provide transportation for folks to come in and meet with our clinicians or our addiction specialists, and then also to go to meetings, self-help groups, outpatient appointments related to recovery. So basically the services that we offer are really flexible depending on the needs of the person. We don't have a regimented type of service that everyone needs to be.
So it seems to me that everyone's journey is a little bit different. And I think that's one point I want everyone in the community to understand. There is no one answer to helping somebody who has a behavioral health. And behavioral health, as you may or may not know, is when you combine two diseases. So in our specific case, we're talking about substance use or substance misuse, substance use disorder you'll hear, or in mental health. So they can be separate or they can be together. CK, if there was one thing that you could leave us with that you'd like the communities to understand, and if you have more than one, go ahead, but what would that be?
I have a lot. So we want to help you before a crisis happens, before something escalates into a situation where you feel that you're out of control. We want to help you before then. So we want you to come in. We want you to call us. Don't be afraid to reach out. You know, we can provide individual therapy, family therapy. We can refer you to outside providers. If you're having problems with your medications, we can get you in contact with a psychiatrist where, you know, you could get whatever adjustments that you need. So we can offer you a lot of support, get you in touch with a lot of different resources, and we can also help you with any type of, you know, therapy or counseling needs that you might have.
Thank you, CK. How about you, Rachel? What would you like the communities to know?
I just want to add that our services are completely free. We don't charge for anything and we don't require that you have insurance. And you also don't need a police involvement to have access to us. We kind of said that before, but just wanted to reiterate it. You don't have to have police at your house to have access to us. You could just come to the station, call us, visit us online, anything like that.
Excellent, thank you. And Kate, what would you like the communities to know?
A couple things. So the first is that you may not feel like your particular concern rises to the level of giving us a call today. And if that's the case, we do have a website that offers a lot of information on mental health and substance use, and even just day-to-day stress, you know, living through a pandemic, managing parenting, you know, in a challenging time. We put up the website, but it's crediblemindfrontline.com. And you can access that. Anyone in our community can. It has a list of a lot of different resources, and you're welcome to check it out. It's completely free and anonymous. And if you decide at some point that you want to talk directly to a clinician, you can do that later. But this is one way that people can kind of engage and get some support immediately if they feel like they're not quite at a crisis level where they need somebody to step in. And then the other thing that we talked about in part one, but in case anyone missed it, is that we provide free Narcan to the community, and we can also help you access Narcan through other routes as well. The number will be up for that as well, but you can call us at any time. If you're not comfortable coming into the police department, we can come up with a way to get you the Narcan, even if you feel like you'd rather meet us somewhere in the community or something, we can help you with that.
Excellent, thank you. You know, I know myself for one, and I'm quite concerned just seeing the amount of people who might be choosing some unhealthy coping skills during this COVID solution. You know, this is not, none of us really have seen anything like this in our life. And there's a lot of different ways to cope. And unfortunately, sometimes we choose ways that are not as healthy. And I know for one, I want everyone to know, if you've chosen a coping mechanism that you say, geez, this might not be that healthy for me. Maybe I shouldn't be drinking as much, or maybe I do need a little support because of my anxiety. It seems to me like the front line and the numbers that are going to be put up at the end, there's something for everybody. And I appreciate that. Well, if no one else has anything else to add, I want to thank you again for allowing us to come into your home. We hope to be able to come back and do some other topics. If you have a topic that you would like to see, please reach out to one of the numbers at the end. Let us know. Thank you, everyone. Thank you, Rachel, CK, and Kate. Appreciate you taking the time out of your day and talking to the community like this.
Thank you.
Thank you.
Thank
Take
you.
care, everybody.